My name's Alison and I'm a health researcher and I work a lot with visual methods, and I'm going to tell you a little bit about the Pictor technique and how it works in research interviews. So if you've never had a research interview before, it might feel a little bit daunting, and sometimes it's quite difficult for people to just answer a list of questions that the researcher comes up with. And what the Pictor technique does is it kind of hands you the storytelling, if you like. So it helps you to think about everything that's happened for you and the story of your care and the people who've been involved, and to tell the story in a way that makes sense to you rather than a way that makes sense to me and answers questions that I ask. Today, you know a little bit about what the project's about, and it would be great if you could just start by telling me a little bit about your diagnosis and what happened to you.
Right, well, it was about 2 years ago. I got indigestion, a bit of a lump.
What we ask you to do first of all is to think about a particular event that's happened to you, or a series of events. So that might be lots of episodes of care that you've had around being poorly.
Nurse practitioner, they couldn't actually feel the lump or see it, so sent me away.
And to think of all the people who were involved. So these are people who have been supportive or maybe haven't been supportive, people who have given you healthcare or social care, or people who've been supportive among your family and friends. Okay, if it's all right with you, we'll move on to having a go at this diagramming technique now.
Sure.
It's really easy to do, and we ask you to write down the roles of all the people who've been involved onto some arrows. What I need you to think about really is the number of people who were involved in your care and in your support. So not just one of the important things is that you need to write an arrow for yourself. So you write the arrows. That's me, myself. And then you think about the people who've been involved in your care. So that might be particular nurses who've looked after you. It might be doctors or consultants. It might be neighbours or friends. You can put things on these diagrams that aren't humans as well. So people often put pets on them. We've even had a TV repairman appearing in one of these visuals. And once you've written some arrows, then we ask you to arrange them in a way that tells the story of your care. You can do something really abstract with it. You can create a timeline of your treatment if that works best for you. You can add drawing or lines onto it if you want to. So really it's there for you to tell your story in whatever way makes sense for you. When the researcher comes back into the room, they'll ask you to tell the story behind your diagram in any way that you want to. And they can use particular arrows to ask you a little bit more about the people who were involved and who were significant to you. So tell me a little bit about the story behind this chart that you've made.
So underlying the whole thing is the pandemic, because like I say, my diagnosis started right at the beginning of the pandemic. So before that, it's all sort of normal life going on. We had a bit of pandemic, didn't we?
Most people find that making a Pictor diagram makes an interview easier. It's easier than answering a list of questions, and it helps them to remember things as well. And the best thing about it is it keeps the interview focused on your personal story and the things that happened to you, rather than the assumptions that the researcher might make about what they might want to know. Well, thank you very much for having a go at this.
No problems.
And it's good if you're considering undertaking an interview for a research study, the research team running the study will always be happy to answer any questions you might have. You'll find their contact details on the study information sheet. Thank you for watching.